a critical examination of Drive, whose treatment of mental illness. Intro music fades out and host launches into a considered tone. Okay, let's talk about how Doctor Who portrays mental illness. Now, on the surface, the show's exploration of this topic appears commendable. The Doctor, a time-traveling alien, often finds himself in the midst of dark, complex situations, and the show tackles issues like anxiety, depression, and PTSD in a way that's both realistic and respectful. However, upon closer examination, it becomes clear that the show's treatment of mental illness is often shallow and relies on convenient plot devices. The Doctor, with his superior intelligence and magical box read, TARDIS, inevitably finds a way to overcome his psychological demons. This is a problem when mental illness is depicted as something that can be simply solved by the show's amiable hero. It downplays the very serious realities of living with a mental health condition. Real people with mental illness don't have access to time machines or supernatural problem-solving abilities. Furthermore, the show's most sympathetic take on mental illness, the regeneration arc of the 10th Doctor, played by David Tennant, which dealt candidly with the aftermath of war trauma, exists in a vacuum. It's a narrative that's largely disconnected from the show's world building and character development. The show has no lasting consequences or repercussions that would truly mirror the complexities of real mental health struggles. Additionally, the portrayal of other characters on the show often defaults to binary, simplistic representations. Mental health conditions are often depicted as a curse or a weakness, with characters made better or worse by their mental state. This flattens the complexities and nuances of real mental illness, making it seem like a matter of choice rather than a legitimate condition. Now, I'm not saying Doctor Who is uniquely incapable of tackling mental illness. The show's actually done some commendable work in showing characters like Sarah Jane Smith's grandson Luke struggling with grief, or the 13th Doctor's reaction to trauma. But these instances are exceptions, rather than the norm. In conclusion, while Doctor Who's intent to explore mental illness is a step forward, the show ultimately fails to critically examine the complexities of mental health issues. By largely glossing over these topics or handling them in a simplistic, one-note manner, Doctor Who, and by extension, the creators of speculative fiction, can learn from doing better.